Okay, so when I left off yesterday, um, we were speaking of swine intubation, that it's more challenging. Um, the trachea is forward, but it has a bend, which is basically that blind diverticulum. They do laryngospasm, so you will need lidocaine spray um, or lidocaine dropped onto the vocal cords. Um, So best done, again, positioning is either sternal or dorsal. And sometimes they have people put their head back. So people are often done in dorsal. Um, so it's very similar to that. You need a stylet and a laryngoscope and definitely lidocaine. So, and the stylet technique is going to be very similar to what you do with like a baby calf, where you usually someone holds their head up in this picture. Um, you look and try to visualize the larynx, and what you do is you put the stylet in the between the laryngeal folds, and then you thread the endotracheal tube, kind of like you're threading a catheter. So again, the cat, even though you use a stylet with a cat, the stylet never comes past the end of the endotracheal tube. It always stays within the tube just to give it rigidity. But in the swine, you're actually going to place the stylet first. And it's just going to make it easier. And the laryngoscope, you can visualize their larynx. But remember, in the difference in the cow, in an adult cow, is that you use your hand to feel where you're going because you can't see it. In a calf, you can visualize it. So that's the differences between the intubations. As far as the anesthetic machine, they can use a small animal machine unless you're working with a very, very loud or large pig. If they're over 300 pounds, you would have to use the large animal machine. But if you've been to the state fair and you see that very large boar, some of them can be quite large. But for the most part, most of them will probably go ahead and take a small animal machine. And then palpating pulses, again, because they're so thick everywhere, the femoral artery is going to be very challenging. So you're going to want to use peripheral pulses. You can use on the inside of the carpus. And you can do, if it's a very small pig, you can do the brachial artery. Now the brachial artery, brachium is forearm, so this would be like in the armpit, and kind of not necessarily buried in the armpit, but if you're near the armpit, you're feeling on the medial side of the humerus. So you're kind of feeling on the inside of the forelimb. And then you can put a Doppler over a tail artery. So they have an artery that runs ventral to their tail. I've sometimes done that on cats. It's actually, sometimes you can get a good pulse there. And then you can use the pulse oximeter either on the ears or in the inside of their snout. And then obviously respiratory monitoring, it's the same. How do you monitor respiration? I mean, you can watch their chest move, you can watch the bag move. You should, hopefully, if they're intubated, you have a capnograph that's going to measure CO2. So kind of be familiar with places where you can use the monitoring equipment. So this is a Doppler, and this one is placed, you can see this pig is on its back. This is placed on the medial side of the carpus. Now the nice thing with the pulse or the Doppler is it'll give you an audible pulse. So you can hear the pulse, so it's a way to monitor audibly. You can actually place a cuff above the Doppler probe, and when you occlude it and the first sound comes back, that's actually systolic blood pressure. So you can get a systolic pressure with a Doppler, and you can leave it on and you can listen to the pulse. And you can see, you can do indirect measurements by putting a cuff on the forelimb. And again, they're just so thick. That's the challenge. You can see on this, they've got a pulse oximeter. They've pulled the tongue out, but they've also put one inside the nostril. And remember, whenever you use a pulse oximeter, you want the light shining through the mucous membrane side. You don't want it shining from the inside of the snout. You're going to get a more accurate reading. Like when I put it on a tongue, I like the light to shine from the ventral aspect of the tongue because it's smoother and you tend to get a better reading. And what's in the other nostril that so this little gray tube right here, that's actually a temperature probe. And so you can either place those down the esophagus. They have this one inside the nose. In small animal surgery, when you guys are in surgery, we do have a temperature probe on the monitors, and you can put this down the esophagus, and that way you can get a continuous temperature. You don't have to keep going under the table and trying to find their rectum underneath all those drapes. You'll get a continuous temperature reading. But temperature, leading into that, the reason that temperature is so key in swine is they do suffer from a condition called malignant hyperthermia. Sometimes people call it porcine stress syndrome, but it is malignant hyperthermia. It's typically brought out, and this is important to understand for the test, but it's brought out by inhalant anesthesia, and it's actually a genetic mutation. If they carry this gene, and it typically does not cause a problem in everyday life. I mean, you may not even know they have it until they're anesthetized. And when the inhalant is beginning to be metabolized, they start to show the signs of malignant hyperthermia. And an animal under anesthesia, you do need to know signs, they will become very rigid. So, an animal that's anesthetized should be very relaxed. If the muscles are rigid and you notice the temperature is going up. Now, 99.9% of the times when an animal is anesthetized, their temperature goes down, or it may stay around normal, but it's very rare to have an animal under anesthesia with a temperature increase. And sometimes I think of a reaction, and this is not a reaction to the anesthetic. This is a genetic mutation. I mean, it's not an allergic reaction, I should say. It's a genetic mutation that's brought out. The other thing you're going to notice is a spike in CO2 that does not necessarily respond as well to ventilation, because normally when CO2 goes up, you ventilate, you bring it down. But this is where it's keeping, and we're talking it's getting in the 70s and 80s. It's getting very, very high, and they will die from this. It is fatal. If you start to notice, well, the other thing that's not on the symptoms is they also get very injected mucous membranes. So they almost look brick red. And normally dogs are pink, or any animal under anesthesia, normally they're pink, and sometimes they get pale. It's very rare to have this very red, dark, injected mucous membranes, where the CRT is extremely fast. So that's another rare finding. The only thing that you can try to do is, usually you need to stop the anesthesia and deliver oxygen. Now, the reason you're delivering oxygen is you're trying to dilute out the inhalant. There is a drug that treats it called dantrolene. It's the only medication, and this has to be given during IV, during the procedure, or during the anesthesia. You're still always going to try to wake them up. Actually, humans and pigs are predisposed to malignant hyperthermia, but I will tell you that it used to be worse when we used halothane anesthesia. I actually lost a greyhound to this when I was at Purdue. It was a rescue greyhound. It was going to be a blood donor. We were spaying it, and we were going to do a dental, and I noticed the CO2 was spiking, injected, but we were finishing the spay, and it was going down for the dental. But I guess when they took the temperature, because we didn't have a temperature probe, and I didn't, it was a quick spay, and it got down there, and it was already up to like 105 during the dental, or during the beginning of the dental, and then it went into cardiac arrest. So, but we did not have dantrolene because it's not super common. Human hospitals carry it. We could have tried to get to the human hospital, but by then it was too late. So very rarely are they cold. They're cold, 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 but they very rarely get warm or overheated during anesthesia. So that's malignant hyperthermia. And then as far as recovery, the same theories apply, is that we want to start to see purposeful movement, swallowing, movement of the head. Maybe they're trying to raise their head. And then you can remove the tube when necessary, and then always watch their breathing. The only special thing I would say is that if they're going to be hospitalized, if it was a very ill pig, you can probably leave that catheter in, but you know, because they're so kind of crazy to handle, and you're probably going to try to pull the catheter before you know, before they're going to be completely awake, because again, trying to restrain them is going to be difficult. Okay, let me go ahead and pull up our study guide. Where are we here? Okay. Okay, so I'm just going to go through some of the study guide as far as why, you know, obviously for number one, why are they not heavily sedated? Usually it's due to their temperament, you know, because they're easier to handle. You can do standing sedation. And the same language applies. If we say TIVA, that's anesthesia, total intravenous anesthesia. Standing sedation is a heavy sedation. You can do light sedation, which is kind of like a light pre-med, or you can do full general, which is an induction to intubation to being maintained on gas. And then what type of table? You usually in cattle use a tilt table. So usually the wall has the table built in, you strap them in, and you can turn them over. Can you use guaifenesin in cattle? How do we give it? So we do have guaifenesin. It is the same to give to effect. It's usually part of an induction protocol. It's a muscle relaxant. It is part of their induction protocol called double drip. Now remember, double drip is basically your guaifenesin and your ketamine minus your alpha-2. And okay, I'll get to that in just a second. For number 4, should you use anticholinergics in cattle? It is not recommended due to the fact that it makes their salivary secretions. So they have excess salivary secretions, and it tends to make what secretions they have too thick. And we have to be able to suction them in case of an airway emergency. So usually it also can slow down the GI tract. So, you know, because of their unique digestive physiology, we don't necessarily want to slow them down too much, but usually the reason we don't use them routinely, you only use them if it's an emergency, is just because of the salivary secretions. For number 5, for intubation, they need to be sternal. It is a blind intubation, and the blind intubation is done by feel. So it's different than blind intubation in a horse. If it's a calf, it says identify the equipment needed for intubation. So you need the tube. If it's a calf, you need a stylet and a laryngoscope. If it's an adult cow, you just need the endotracheal tube and a mouth gag. You're going to need something to keep their mouth open because you have to reach your arm and feel their larynx. So it's done by feel. Why do we have suction set up prior to intubation? Due to their heavy amount of secretions, a lot of their excess salivary secretions. And why is intubating small ruminants so difficult? You can't open their mouth. They have a thick tongue. It's very difficult to visualize the larynx, so that's why we use, and they can laryngospasm too, so you definitely want to take care when intubating calves. and small ruminants, goats, sheep. When under full inhalant anesthesia, do they breathe on their own? Now, I know that's a vague question. They probably try to breathe on their own. It's not that they completely don't breathe. They're just not efficient. They are just like I talked about with the horse. They're prone to atelectasis and hypoventilation due to their large weight. So usually if they're going to be on an inhalant, they're going to be put on a ventilator to maximize ventilation, just kind of like we talked about in the horse. How should you position their mouth in relationship to the pharynx? Their mouth needs to be lower to help drain any regurgitated fluid and any saliva. So try to position their mouth tipped a little bit down. Cattle tend to recover better than horses, but what are 2 key post-anesthetic complications we were looking for? Explain the clinical signs. Well, number 1, I told you cows don't colic, but they do bloat. So what we look for especially is the left side. Is there any bloating? And we also worry about aspiration of excess saliva and regurgitated fluid. So you want to watch their breathing, watch for excess secretions, watch for any bloating. Now you still have to watch for myopathy and neuropathy, but remember there's key things about the cow that are a little bit different than the horse that you need to look for. And clinical signs, obviously, if the left abdomen is swollen, if we see, sometimes they're blowing bubbles when they're recovering because they're trying to breathe and they've got the excess saliva. If you see the stomach secretions. And then, why do we decrease the dose of xylazine in cattle? They are extremely sensitive to it. An average cow is going to get, remember, if you have a horse and a cow that are 1,500 pounds, 2 years old, and a horse gets 1 ml, a cow is going to get 0.1 ml. So it's 1/10 of the dose. It's that low. So they are extremely sensitive. That's why it's not typically part of the double drip. It's not that you cannot use it, but the dose has to be severely decreased. And even though it's reversible, and you can always give more, you would definitely start on a very, very, I just don't want you to think, oh, I work with horses and cattle. Oh, they weigh the same. I'm going to use the same drugs. It's going to be different because the cow is going to be a little bit different. What makes pre-anesthetic assessment of swine a challenge? Well, their temperament. They're often excitable, screaming. They don't like to be restrained. So make sure you're going to have to do observation kind of first. Observe respiratory rate, and this is just a good technique. I'm amazed. I've asked sometimes people on tests, different student groups, can I get a respiratory rate without a stethoscope? And people tell me no. You can observe respiration outside of a cage, outside of a run, inside an exam room with an aggressive patient. You can sometimes even sneak and look at their gum color. You can look at their, the condition of their eyes. Do you have any nasal discharge? What does their coat look like? Are they interactive? There's a lot you can tell about an animal without actually touching them. So in a swine, you're going to have to do as much as you can. And also you're going to be relying on history from the owner. Is there anything in the history that's a red flag? Now, where do we obtain a blood sample on swine? I did not go in depth about this. You can use the ear veins, but you can actually, you may have to do what's called a blind stick, and you go proximal to the scapula, kind of near where the jugular would be, but you can take from the deep artery, the brachial artery, and that's a very kind of scary technique. But if you need to do small sampling, you can do the ear vein, or you can sometimes do a lateral saphenous, but they may need to be sedated before you do those. So realize you may have to anesthetize or kind of knock the pig out before you get blood work, radiographs, and things that you would normally have way ahead of time in a different patient. What size needle is used for injections? Why do we choose? You need at minimum a 1.5-inch needle because of their thick layer of subcutaneous fat. So if you're going to give an IM injection, if your regular standard 3/4-inch needle, you're not going to be where you need to be. As far as diameter or gauge, more than likely, you're probably going to be upwards of an 18 gauge. They're thick, they're tough. A 20 gauge, you run the risk of bending it, so probably going to need at least 18 gauge. But what's important is the inch. You need 1.5 inches in that needle. Why do we use the muscles of the neck? Because we don't want to damage the muscles of meat. Now, again, if this is a potbelly pig and they're not going to slaughter, maybe you can choose other muscles. But the other thing is if an injection is to abscess, it's definitely easier to drain and treat an abscess on the lateral neck than if you use the high gluteal muscles. That's another thing in large animal, why we don't choose. A horse has those big gluteal muscles that'd be perfect for injections. Except, number one, you don't want to be behind a horse to give an injection there typically. And two, if it abscesses, it's a harder location to treat. It's much easier to treat an abscess on the lateral neck. But in swine, because they're meat producing, you don't want to damage those muscles that are often used for your Easter ham, basically. What is the TKX and why do we use it? TKX is tilazol, ketamine, and xylazine. And this is a very potent sedative. We use it in swine because it gives us good immobilization. That protocol induces anesthesia. They will be asleep. You can decrease the dose and make it sedative. But if you use normal dosing, it's designed to be an induction protocol. And again, understand that that's kind of not normal because tilazol and ketamine are both dissociative drugs. You're giving two drugs in the same category. Normally, we don't double up. We pick one from each category. That's the principles of making a pre-med protocol. But in this situation, they are combined. But again, remember, tilazol is tyletamine and zolazepam, which is technically a dissociative and a benzodiazepine, but they come as one injection. They're pre-combined. You dilute it. It's a powder. You reconstitute it. It becomes an injectable. How do we monitor anesthetic depth? Their eyes are not reliable, so we talked about their muscle tone in their jaw. So jaw tone is going to be a good indicator, and any kind of general muscle tone. But also you can check for ear twitch reflex. You can try to pinch in between the little hooves, and then you can try to pinch in between there. Obviously, your heart rate and respiratory rate. If your heart rate and respiratory rate are going down, more than likely your animal is getting deeper, and if they're going up, a lot of times they're getting lighter. So you have your vitals, but reflexes, the eyes usually tell me a lot. They're just a little unpredictable. Where can we place an IV catheter? We talked about the marginal ear vein, potentially a lateral saphenous. And can we mask induce? No, unless they're very, 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 very ill. More than likely, you're going to have to give them some injectable, because to mask induce something, you have to be able to restrain it. And ideally, you can give them a deep sedative. And the pictures and the PowerPoint that had the mask, they were kind of like topping off. So they weren't like inducing them for the first time. So since I just talked about intubating swine, I've just talked about these questions here at the end. So hopefully you understand why they're challenging. This test will open tomorrow at class time, and I think close around maybe like 4 or something. It's a little bit shorter quiz. So I'm probably going to time it at 65 minutes instead of 75 minutes. But it'll open up tomorrow. So we won't Zoom tomorrow. You'll have the test, and then we'll start the new stuff on Thursday. Do you have any questions?
Okay, so the test is, you're saying you're opening it at 8 and you're closing it at 4?
I have to double check that, but I think that's what I did last time.
Okay, no, last time you left it open for 24 hours because Wednesdays are the days where
The only reason I did 24 hours last time was because
it was long.
Hmm.
It's the same.
Well, like we did it long last time because I can probably open it a little bit later, like maybe 7 or 8. It won't be 24 hours, but I can maybe do 7 or 8 p.m.
Yeah, because like Bethany's saying, because we have your class and then we have our other classes and then we have to go out on the